right, so for this week's Challenge Wednesday, we have Martin, and Martin has a history of alcohol abuse along with chronic use of over-the-counter anti-inflammatory medication. Now, the patient's medical record indicates an elevated ALT enzyme and an insidious onset of generalized fatigue and discoloration of the skin. The least likely to be found during a routine examination is, all right, so we have A, oncholysis of the fingernails, B, flapping tremor at the wrists, C, nails of terry, and D is excessive redness of the palms. Oh, y'all want me to go back on A, right? You're like, what the heck? He says some onycholapa? Like, what the heck is that? No, oncholysis. All right. And you may have seen it or heard it said a different way, but oncholysis or oncholysis, it's spelled oncholysis of the fingernails. It's one of those little fancy names that you saw come out of your book and you're like, what the heck is that? How do I even pronounce it? Yeah, well, that's one of the answers here. And I need you to be ready for these things on the NPTE. You got to be able to say what those words are, what they have to do with as far as the nails are concerned. You know, you really have to understand that nail deformity very well. All right. But whether you are weak at it, strong at it, we are going to dominate this question right now. So let's go up to the top. We got Martin, has a history of alcohol abuse, along with chronic use of over-the-counter anti-inflammatory medications. I think that that's important, and I really want to stop there because as we think about it, what does alcohol abuse do to the body? What does that do? I mean, it starts to cause a lot of gastrointestinal problems for sure. It can start to break down, connective tissue throughout the body, with alcohol abuse, of course. But how about some of the organs that start to struggle? Kidneys, yeah, I like kidneys. But one of the major ones is the liver, right? Because the liver is responsible for definitely breaking down, metabolizing a lot of those toxins that come throughout the body, cleaning that, right? Filtering that. And so the fact that the person's having this alcohol abuse or they have a history of that, they're also using anti-inflammatory medications. We were talking about the ibuprofen, the aspirin, all that good stuff, Aleve. So if the patient's using a lot of that, again, what structures are really getting the brunt of it? They're getting damaged by it. Again, you could say the kidneys here. You could say the stomach, right? You start to develop peptic ulcers from anti-inflammatory medications. But one of the major ones that really takes the brunt of this abuse is the liver. And so these are just some ideas that are going through my head as I'm looking at that first sentence. Now, as I move to the next, it says the patient's medical record indicates elevated ALT enzyme and an insidious onset of generalized fatigue and discoloration of the skin. I need to slow up again for a moment because I really want to break this down. I think it's important for you to know. Now, when you look through your lab values, maybe you went to the doc and got a CBC and a lipid panel and all these different things, and possibly along those lab values, you saw ALT. Have you? I mean, for those of you listening to me right now, have you ever seen ALT come up as one of the lab values? Well, if you did, do you know what that really means? What is an ALT enzyme? When does it really come up? Well, it stands for alanine aminotransferase enzyme, and it's actually found on the inside of your liver cells. Yeah. And so if you're getting an elevated ALT enzyme in your bloodstream, it's kind of like, why the heck would that happen? Think about it. If you damage those liver cells, what starts to pop out, leak out of them? The ALT enzyme, exactly. And so if you ever see an elevated ALT enzyme, especially when it has to deal with the NPTE, I'm thinking liver damage. And so everything that the question was telling me before about the alcohol abuse, the anti-inflammatory medication where you were chronically using it, well, the elevated ALT enzyme is just solidifying that this patient's having some type of liver damage at this point. The rest of the sentence says insidious onset of generalized fatigue. Do I get that with liver damage? Yes, you do. How about discoloration of the skin? Well, have you ever, heard of that one J word? We say that J word a lot of times. It has to do with discoloration of the skin and the liver. Yeah, you got it. It's jaundice, right? You can have that discoloration, the yellow discoloration of the eyes and the skin. And yeah, so that's very consistent with the liver. Right now, I have so much information right here to say that I'm dealing with some type of liver damage. And the question stem, the last sentence of the question, it says, the least likely to be found during a routine examination is, all right, paying close attention to the fact that it says least likely. So really, bottom line, this question is really asking you, which of the following should I not expect with a patient who has liver damage? All right. And so for those of you on the podcast, I really want to go over these answers again, just so we can kind of refresh on them. So we got oncholysis or oncholysis of the fingernails. That's A. B is flapping tremor at the wrists. C is nails of Terry or Terry nails. And D is excessive redness of the palms. So let's break these down one by one. A. All right. We said it was oncholysis or oncholysis. Sorry, see, I'm messing up the name too. Of the fingernails. Well, what really is that? Well, a lot of times we see this when a patient has like repetitive trauma or just trauma to the nail bed. It's where we have detachment of the nail from the nail bed, and it starts distally. All right. A lot of times we can get this with conditions like sarcoidosis, hyperthyroidism, Graves' disease, something along the lines of that. We can see it with OCD, patients who maybe are nail pickers. They pick out their nails a lot, or they repetitively tap their nails on something. We can start to see that detachment of the nail from the nail bed. Another one, reactive arthritis, you can see this in, or just basic like trauma to the nail itself could cause this. All right. Now it sounds pretty painful, right? Like the nail bed coming or the nail coming off the nail bed. Oh, that sounds painful. But actually, this is a pretty painless condition. All right. Oncholysis of the fingernails. Do I expect to see this with the liver damage? I don't. I mean, you could see it with a patient who has liver damage, but does liver damage cause this? No, it's not typical. And so what I'm going to do is I'm going to put a check mark next to this letter. Check mark next to A. Why? Because remember, the question's asking for the least likely to be found during a routine examination. Least likely. And so right now, that's looking like the right answer. But let's look at B. B says flapping tremor at the wrists. Now, this is one that you can look up in your Catherine Goodman book, Differential Diagnosis, or the pathological book, and go through there and you'll see the flapping tremor at the wrist. It's also known as Asterixis. And this condition is when the patient extends the elbow, extends the arm, extends the finger, spreads them out. And then you start to have this involuntary just flapping at the wrist, this tremor. And so this is very common in patients who have some type of encephalopathy. Hepatic encephalopathy is one of the more common ones, and they can present with this Asterixis. All right. Also, the flapping tremor at the wrist. You may see it written both ways. Again, is this common with somebody who has liver damage? Yes. Hepatic encephalopathy, which is dealing with the liver. Again, some type of liver damage potentially causing this. And so what I'm going to do is I'm going to put an X next to it because I would potentially see this on an examination. All right, let's look at C. C says nails of Terry. All right, so let's take a look at this one because you can see this written different in different texts. All right, nails of Terry are also known as Terry nails. Now, are you familiar with that lunula? All right, so that's that crescent shape. If you look down at your nail right now, you should see some white crescent shaped structures, really close to the cuticle, right? A lot of us have it. If you don't see it, you may need to push back your cuticles a little bit and take a look at it. Again, it's that like half shape or half moon shape that you have. They call it a crescent shape. Well, when a patient has nails of Terry or Terry nails, they don't have that lunula. All right. They don't have that structure. Instead, the entire nail appears white. And so this tends to happen when there's like an overgrowth of connective tissue underneath the nail, something along the lines of that, maybe decreased vascularity. And so can this happen when a patient has some type of liver damage? The answer to that is yes. Yes, yes, yes. So when you think about nails of Terry, I want you to think about whited out nails. Nails that don't have that lunula. Nails that don't have that pretty, half moon crescent shaped structure in them. All right. Instead, the nails are completely white and it's due to some type of decreased vascularity or increased connective tissue. So I am going to put an X next to it because I would expect to see that with some type of liver damage. All right. Let's look at D. D says excessive redness of the palms. Also could be called Palmar erythema. All right. Excessive redness of the palms. Well, I have something to tell you here. I would expect to see this with some type of liver damage because the liver is actually responsible for breaking down this major hormone called estrogen. Have you heard of that one before? Female sex hormone, estrogen. Yeah. So the liver is actually responsible for metabolizing that. And when the estrogen in the body, also known as estradiol, when it is not being metabolized, it continues to move throughout the bloodstream, causing an increased vascularity in places like the palm. So you can have all this redness that starts to show up in the palm. We call that palmar erythema. All right. And that is consistent again with a patient who has liver damage. And so guess what? I am going to rule out D right now. That is going to leave us with our final answer of A, the one that I'm having trouble pronouncing. I know you might have trouble pronouncing. It's Oncholysis. I have it like written out into these little syllables on my computer right now. It's Oncholysis of the fingernails. All right. So there you go. Final answer here tonight is A. Again, we were looking for the least likely to be found during a routine examination when a patient has liver damage. Now, in order for you to get these questions right on the NPTE, I think it's really important for you to understand the different types of nails that there are out there. I know you may have seen it in PT school where they brought up these names. Like the spoon nails, the nails that have the deepened crater on the inside, they look like a spoon. Yeah, you may have seen something like that. Listen, these are very, very important nail types to know, and the conditions that, produce them or cause them, it's really important for you to know that as well. And so what I did was I created a cheat sheet to take you a step further that are going to have the top 4 nail types for you to know. And I have actual mnemonics for every single one of them to tell you a bit about the conditions that cause them. Sound good? So I have all of that waiting for you. So if you're on the podcast, what I want you to do, go into the show notes, click the link in there, because I have a freaking cheat sheet that is going to explain these nails to you and the conditions that cause it. So go in there and freaking get it.